All right, so I'm going to welcome you all. My name is Michael DBAs. I'm Director of Administration, and it's my colleague Melba Depeña, who is the Director of the Department of Human Services. We wanted to give you an opportunity to hear from us and ask some questions about a major reorganization at the Department of Human Services. In connection with that reorganization, we issued layoff notices to about 70 DHS employees. That reorganization is connected with a new eligibility system, which is replacing a very old legacy system and is going to be a major improvement for the neediest Rhode Islanders who rely on a range of health and human services offered through the Department of Human Services and some of our other agencies. It will allow them to have better access of those services, get those services more promptly. It will also deliver substantial savings for taxpayers, both by identifying and eliminating fraud and waste, and also creating efficiencies to do this in a way without paper and also use less staff. So what we'd like to do is, I wanted to turn it over to Melba to talk a little bit about the business process changes, because this is not only the addition of technology, it's actually a business process change. It changes the way eligibility is done. And then I'm going to talk a little bit about the layoffs themselves.
Thank you everyone for the opportunity. Just to give you a little bit of background, the Department of Human Services, it's made up of about 6 field offices that are located throughout the state. In addition to that, we have 4 divisions that serve many Rhode Islanders. Just to give you an idea, we provide benefits for cash assistance, food assistance. In fact, 1 in 5 Rhode Islanders rely on food assistance through our SNAP program. So it's a very significant department that provides services. We have decided to reorganize the department as we implement the new eligibility system. As Director DBAs mentioned, we have been engaged in a business process redesign for several years, as we have encountered a department that was very siloed. We have many of our programs and units that determine benefits were very isolated into specific programs. And as we launched the new eligibility system, we felt that it was important to redesign how we do business. We will continue to offer services in all of the 6 field offices. It is important to our families that there is that interaction face-to-face. The new system will be an incredible tool for our workforce. Right now we're currently operating with a system that is 30 years old, very inefficient. This system will not only enhance the customer service that we offer our clients, but it also facilitates the way we do the work internally at the department. We put in a lot of time to think through how we wanted to reorganize the department so that it's completely aligned with the new system that will be launched in September. We're just a few weeks away from going live with the system, and we are looking forward to the customer service that it will bring to our families. We also understand that it is a difficult time for us in Rhode Island and at the Department of Human Services because 70 individuals will be affected. However, we have worked to ensure that these employees for the Department of Human Services have opportunities in other departments that we have been working with. DCYF, for example, Buddha, and others, where we hope they will be able to take those opportunities. And we will be moving forward with the reorganization and going live in September with the new system.
Yeah, so let me just pick up on a few things that Melba talked about. So we're going from a system where eligibility was determined on a program basis, so folks had to apply often in duplicate ways in terms of their information for different services, to a single eligibility portal where those folks that need services will be able to actually apply themselves online and be able to track their benefits. So that's a very dramatic change in how the work is being done, and it results in a significant impact on all of the Department of Human Services employees, and a significant realignment is required simply because of the way we're going to be doing business. The most serious impact is the layoff of the notice that was sent out today to lay off approximately 70 of the Department of Human Services social workers. As Melba said, we recognize this is an upsetting time for those people who received those notices. They are our colleagues. They've chosen a field to help people. They have mortgages and car payments and families. But we've been working hard over the last several weeks and even before then to minimize the ultimate job loss for these state employees. Most of them will have the opportunity to bid into comparable positions at other places in government. There are, we expect there to be approximately 40 to 50 vacant social worker positions at the Department of Children, Youth, and Families. Those are positions that are needed. They are not positions that were created for this purpose. We're going to fill those positions regardless of what happens here. We also have over a dozen new positions in the Department of Employment and Training that the social workers would certainly be qualified to take. So we hope that the people who are laid off will take advantage of those opportunities. There are also bumping rights involved for them because they're union employees. For those that do ultimately lose their jobs, and we hope there are very few at the end of the day, we will provide rapid response services for them through the Department of Labor and Training. And they will also receive unemployment benefits.
One last thing that I would like to add is that the new eligibility system is key because it's going to integrate health and human services. In other words, right now, it's a family who would like to come into the field office to apply for social service benefits. They go to one office. If they want to apply for medical, they have to go into another office. And so what the system will do is to integrate those services in one application by inputting the data into the computer. That information is applicable to any other programs that they may apply. So it really brings innovation and certainly enhances the customer service that we provide at the Department of Human Services as we integrate with Households Allied, for example, as we provide medical assistance as well.
Yeah, I think I'm going to open up the question in a moment, but as you can imagine, this is an enormous amount of change for people who have been doing different tasks. Not only a tremendous amount of training that has been ongoing in terms of how to use this new system, but just the manner of the job itself is going to change. So let me throw it out.
So there's a possibility you may not have to lay off 70 people overall, that some of these people will be placed in jobs within the administration?
Most of them will have the opportunity to bid either for these other vacant positions or to bump. And we think at the end of the day, there will be much fewer than 70. But if that's going to depend on their actions in terms of, and also cooperation with the union.
Are they all social workers, or are there some higher administrative people or lower people?
We do have what we call social workers 1 and 2. In addition to that, we have downsized the number of supervisors, and we have downsized the regional manager's position. So it ranges across those 4 job titles, mostly affects social workers.
Can you break that down in terms of numbers?
There are 3 regional managers. There are 5 chiefs, what we call chiefs, and we have downsized about 10 supervisors, and then the remainder are social workers.
And so their positions are no longer necessary because the system is basically taking over those functions? Is that the basic idea?
We have been working for the last 3 years in a new staffing model that it's basically supervisors and no units in between, but rather a group of individuals that are assigned to claim tasks. So it's task-based rather than caseload. And as a result of that, we need less supervisors because we now have a group of individuals who are establishing eligibility for programs rather than being placed into a specific unit for a specific program.
And there also are efficiencies gained through combining the eligibility, avoiding duplication, allowing the customers to actually enter their own information. So there is a need for less staff overall as well.
When you talk about efficient,
Yes, all 6 field offices, and that is a very, very important message that I really want to get across today. All 6 field offices will remain open. We downsized Woonsocket, who was, the lease is going to expire on the 31st of this month, but we are transitioning into a smaller office. But all 6 field offices will remain open.
is there a cost savings associated with all of this?
Yes, so we expect significant cost savings both in the current year and next year. I would say that most of that comes from cutting down on waste and fraud and duplication in the benefits themselves. So there are some substantial staff savings, but most of those savings come from a system that is much tighter in terms of who is eligible, tracking when they are no longer eligible, and we'll actually get benefits to people more quickly, but we think we'll save in the long run.
On the order of how much are we talking about there?
I think what the current budget calls for approximately $15 million in general revenue savings in FY17 and approximately $40 million in FY18.
That is.
What do we
These
think?
don't, if I can just follow on that, but these don't necessarily, that isn't from personnel cost savings out of the people being laid off. That is the efficiencies that you're looking at?
That's all in. That's all in. The labor savings are a much smaller proportion of that. Most of that comes from better benefit coordination.
Do you have those figures?
The breakdown is...
We can provide.
Yeah, we can provide it,
those.
so it's mostly around keeping individuals on the programs as they are eligible. Right now, again, talking about 30-year-old technology, if someone reports a change, it takes 5 to 6 months for that change to be reflected. So potentially, we have families that stay on a program longer. So this system will have real-time data through interfaces that come in, and as a result of that, we know when we should be paying more for a family or when it should be less, and that is the projection that we have.
In many aspects that are required by the federal government, the federal government has paid the lion's share for this system.
With the layoffs, are there severance packages? Is there a plan in place for these 70 employees?
No, there are no special severance packages. We're going through the collective bargaining agreement, working with the unions, hoping that because we have this opportunity of other positions that we can dramatically minimize the layoffs, the ultimate layoffs of people losing jobs. You know, it should be noted that there are bumping, so the individuals who receive these layoff notices may not actually ultimately be the people who...
What are the impacts going to be on clients as they come there to get services?
No impact on clients.
In Woonsocket, I've heard that people have been turned away because there's limited services available there.
So let me tell you about Woonsocket. So August 31st, it's the end of the lease. And quickly after that, we will resume operation in a new location in Woonsocket. Currently, what we do is we have limited services that are being offered at the Woonsocket office. What you may think is turning away is actually redirecting them to a Pawtucket office.
Right.
That's what's on the signs, the signage that we have at the current location,
Right.
and the notification that they received as well.
Well, for those people, it was a 4-hour bus ride? If you were-
Potentially.
Yeah, and so they
Yeah,
took
I'll let
they
it
took
back.
4 hours to get to Pawtucket and back
Yeah.
from Socket.
And how is that not an
Correct.
impact on those people?
So that is precisely the reason why we made an effort to stay in Woonsocket, because we recognize that our families rely on transportation. There's no way that we could close an office and open up another office without having a couple of days or weeks in between to make sure that the office is operational. So what I'm saying is that there's no impact in the reorganization that we're doing right now, but certainly the lease ending in Woonsocket does affect families from Woonsocket that need to travel to Pawtucket.
What services are not being offered in Woonsocket right now?
Correct, that's correct.
No, what services are not being offered in Woonsocket?
Which offices?
No, what services are not being offered in Woonsocket?
So what we have there is a very small team. If somebody walks in and we could take an application, we could start the application. If someone requests an EBT card, we could start the process. Typically, we give them the EBT card immediately, and the office is one of our services, one and done. In this particular time, we cannot print the EBT card on the spot, so that the EBT card will be mailed to them.
Right.
If somebody comes in and wants to report that they lost their job, we could take that information, enter into the system, and reflect the new benefits amount. So those are the services that we have, and we have clearly put up in every door that those services are limited and they have received notices.
Would I know going up what services I could not get, so I would know to go to Pawtucket instead of there? Because I don't see any listing of what services are available in Pawtucket that I couldn't do. You know what I mean? I don't know what I can't do when I go to Pawtucket.
Right, so individuals will mail a notice that gives some information to be assigned to Pawtucket. The other information that I also want to share with you is that we have other cities and towns, the surrounding areas, that are also have been reassigned to Pawtucket, not just Woonsocket families.
Yeah, that would be like Barville and Smithfield, which is also a very long bus ride as well. But
Correct.
another question, when was that notice sent out to the clients?
It started getting into their households on the 23rd.
23rd. And what day were the limited services started to be unavailable or available?
The Friday before, so
Right.
Friday what was that, the 19th?
Yeah, I guess.
So presumably in September, when the system goes live, people won't have to go to a field office. They can go to, if they have a computer at home, they can use that. If they go to the public library and use a computer there, or another social service agency.
Correct.
This
And
is all
that is
online
also
now?
And that is also part of the notice that was sent out to them, where we specifically said office will be closed August 31st. So September 1st, this is the new location. And as of September 30th, we gave them the 30th just to make sure that the system is up and running and that they could access the online portal. Anyone could potentially apply online without the need to go to the field office if you don't.
And there will be a
What's the
Woonsocket
website?
DHS website.
It'll be on the
Yes,
DHS
yeah.
website, and it'll be called,
It has no name, it's a new eligibility system, but when
Okay.
you go into DHS, it will say apply online. And it will have a very visible icon that says apply online.
And that system's been delayed, correct?
I'm sorry?
That system's been suffering some delays?
Let me tell you,
Yeah.
let me talk a little bit about that. We were going to go live in July, and in conversations with our federal partners, we determined that in order to not have a negative impact on our customers, we needed to have additional testing of the system. And in fact, we moved the go live to September. That is correct.
how
So
are
this is
tests
the,
going now?
It's going well. We have a pilot that is being run in Pawtucket right now, and it's going well. We're on track.
Are you anticipating problems with the rollout?
Not at this time.
Right now, we're on target for launch on September.
right, so this is the total UHIP system,
Yes.
which I think's name got changed at one point to Bridges, Rhode Island.
Rhode Island Bridges.
Rhode Island
I'm not sure it
Bridges,
was ever-
excuse me.
I'm not sure that the name was ever.
All right, so what is it called now?
It's just a new integrated eligibility system for our workers when they log into the computer. It won't say Rhode Island Bridges, but it's not a name for a new software.
Okay, and when this was used in terms of Health Source Rhode Island, there were a number of glitches that happened where things had to be manually overrode because things were not proper. Have those glitches been corrected?
So actually, that's part of the same system. So we've actually made operational parts of the EWIP system. The health exchange is one, the Medicaid side is the other. And there were issues that were that we had to deal with. There will be issues. I mean, this is a massive integration of converting data, 30-year-old data, and highly complex federal programs. So we will have some bumps in the road when we launch this thing. It is not. These things, even in the best of circumstances, not going to go smoothly. But we prepare for that, and we have staff and contingencies, and we're doing our best to make sure this goes as smoothly as possible with minimal disruption.
To the people in Woonsocket, in the Woonsocket area, why not send out the notices earlier if you knew the system was coming? We heard reports that people were getting the notices after they went in and found out that they couldn't obtain their services there anymore.
There are services there up until the 31st, so I'm surprised to hear that they did not get the services. Our initial intention was to go, we went up for an RFP, it's public information, where we wanted to co-locate with DCYF and DHS. Unfortunately, there were no bids to that RFP at the time. This was about 8 months ago.
Okay.
So what we did was we began to talk about, so what are our options? So we decided to separate the two agencies. We went out with a second RFP, and as a result of that, there were some delays in getting the State Property Committee to approve that. We could not, by law, communicate a new location until we had the approval from the State Properties Committee.
And why not do something like, something's going to change, we can't tell you exactly where you'll have to go, but be on notice that it's going to be tougher for you to be poor in the next coming weeks.
That is precisely what we did.
But we're hearing that some people actually got the notice after they went in and found out they had to go somewhere else for the services. So one thing we heard was people were getting so you said, I think you said the notices started going out on the 23rd, but we heard that the notices were still going out this Monday. So maybe some people got them.
This Monday was the 22nd, so that is possible.
Okay, all right.
Yes.
We have time for a couple more questions.
Yeah, I would just add on that. I mean, this is obviously related to the reorganization in the Woonsocket office, but the plan was to always continue to have a Woonsocket office. This break in service was unfortunate. It was the result of that we were not able to acquire a property to not have some break, and hopefully it will be less than a month that we won't have a location in Woonsocket.
Was that a mistake trying to incorporate switching offices with the new software? Like, would it have worked smoother for the clients had you done it a different way?
Unfortunately, we have no choice. The current location had asked us to vacate the place because they need that building for another project that they have ongoing. Our landlord's tender missed, and you will be hearing more about the project that they have. So we had no choice but to vacate.
I understand there's a meeting Monday with the Medicaid director and 4 CEOs of long-term care associations. What is that about, you know?
I can get back to you and I can look into that for you.
Okay, and one other thing. So did you consider a soft launch at all? Can you talk a little bit more about the steps you have in place to ensure that you'll be able to deal with these glitches? Because...
So, I mean, we have a vendor, and these things, you know, there are various stages and various activities that happen leading up to September 13th before these it's not a simple Thunderbolt at that time, so there is definitely staging of some of these things. But at the end of the day, you have to turn the system over. You got to turn it from the old one to the new one, and rely on the data that comes over. And so it's just a gigantic exercise. Definitely by far the largest technology project that has ever been undertaken by the state of Rhode Island.
And the vendor is Deloitte?
Deloitte is the main.
And are there contract provisions if things go wrong where they have to pay for the glitches?
There are, as you can imagine, many contract provisions.
Did you say September 13?
12?
I understood the date to be September
13th.
13th.
And that's what, the day you're going to turn that on?
That's the launch. That's the official launch.
1/3, not 30th.
13th.
13. And what did all this cost?
I'm sorry?
Over 30 years or whatever it is, what did all this cost?
The cost of the
The
new
technology,
system?
yeah.
I can get you those numbers.
Yeah, there's various
So you've
numbers.
heard 300
There's various numbers, and I'd rather, because a lot of that also includes staff time operating systems. It
Really?
includes the health exchange, so which are all legitimate, but I think you need to break that down, because I think sometimes people see that as being just the software or just.
Get that today,
Absolutely. Yeah.
like Zoom?
Yes.
Yes.
All right.
And I would just put in context this is a multi-billion-dollar delivery system. So
What does that mean?
well, the value of the benefits that are running through the system are very
In the
large.
billions of dollars.
Yes,
Someone has the figure though, right?
absolutely.
I have
Yeah.
that figure, I can give that to you.
And a lot of that was paid for with federal money,
About
right?
85% was paid for by the federal government. And many of the aspects of that system are required by the federal government.
So you mentioned that 70 people received the notices. Using your best judgment, how many people do you anticipate will actually be laid off?
So there will be bumping rights under the contract. It will be up to the individuals whether they pursue opportunities to bid on available positions. As I indicated, there are as many as 50 to 60 roughly available positions out there. So, but it's really going to depend on cooperation with the union and the actions taken by those individuals to actually know what the impact is at the end of the day, how many people are going to lose their jobs.
What drove this, saving money or offering better service?
So those are the only two choices.
Maybe it's,
I would say both.
or is there a third one, Mr. DiBiase?
No, I just think this is, in terms of driving this particular layoff,
Yeah.
it's putting the right people in the right places where we have an obligation to make sure that we are efficiently aligning the staff to the jobs and the roles. And we also have an obligation to take efficiencies out of the system and bring savings. I mean, this was and is an expensive technology to bring to bear, and we need to reap the benefits of the efficiencies that come from it. That's really, at the end of the day. And we want to make sure we ensure customer service at a high level. We think we can under the staffing model. Melba and her team has spent many months working on the nature of that reorganization.
I'm guessing there's going to be a computer at the locations where people can log on and in case they're not able to get to the library like Kristen suggested.
Yes, so each one of the 6 field offices will have computers and there will be staff available to help them log in. And in many cases, we may start the case application online by themselves while they're waiting. And so that's an added benefit, I would say, because that cuts down on the wait time.
Thank you.